Jignesh, please share the slides also.
Sarah's disconnected. Let me call him. So, a very good evening to everyone. So, on behalf of Cardiac Division from Alembic, I warmly welcome all participants to today's volumetric webinars. So, today's topic is lifestyle tips in hypertension management. Now, I am pleased to introduce our speaker, Dr. Biswa Mishra sir from Ashwini Hospital, Cuttack, who will guide us on simple and practical lifestyle measures for better BP control. Okay, thank you, sir, for joining us in this special evening. So, over to you, sir. Now, slides are visible. You can continue your presentation.
Yeah, thank you. First of all, good evening, everyone, and thank you, Alembic, for giving me this opportunity. So basically, it's all about a topic which we practice every day as medical practitioners. But thing is that it is also equally important for general public to get aware about this disease. That is one of the most common metabolic disease, that is hypertension, which is otherwise known as silent killer. So, if we consider one or two risk factors which will affect each and means which can cause which is a risk factor for each and every individual, specifically in Southeast Asia. That is, one is diabetes, one is hypertension, one is dyslipidemia, and one is obesity. So these things come 10 years earlier as compared to European or American people. So to start with, can we? So we have to be aware that, as we all know, prevention is always better than cure. So once you are diagnosed with hypertension, then thinking about it, that has both means financial, emotional, all stress. But if we can prevent it before it happens to us, then we can get rid of many diseases like heart attack or heart failure or brain CV or stroke or vascular events. So next slide, please. So understanding volume and blood pressure means excess salt intake increases body fluid, and that increases body fluid volume, putting extra strain on heart and leading to high blood pressure. So as we all know that we have to limit our basically what it is known, we have to limit our salt intake. Means if you are calculating sodium, then it should be not more than 2 gram, and if you are calculating as salt, I mean itself sodium chloride, then it should not be more than around 5 gram to 6 gram per day. So why this? Because as you all know, sodium has direct effect on blood pressure, and it can increase the fluid. It can increase fluid retention, increasing of volume. It has effect on vascular system also, causing more stiffness and less relaxation of the blood vessels, and it can lead to hypertension. One of the most common cause of resistant hypertension is high sodium intake. And most of the time in our practice also we see that people will ask that we are taking 3 4 medicines but still our blood pressure is not controlled. So one of the major thing you have to see in them whether their sodium intake is high or not. You decrease the sodium, your blood pressure will be less. So next slide, please. So what are the targets? Means in every disease there are certain targets. As we are aware that there are certain numbers we have to achieve. Suppose I am a diabetic, so I have to have my HbA1c around 7. If I am a healthy person, I can target less than 6.5 also. If I am elderly with comorbidities, then my HbA1c will be around 8. So it is an individualized thing. So same thing applied to blood pressure management also. Same thing applied to cholesterol or dyslipidemia also, or LDL number also. So we have to know what is the number we have to achieve. Basically, in relation to blood pressure, it is an individualized one. But still, in general, if I am an adult and I have a hypertension without any comorbidities, around 130/80 is fine. But now they are recommending less than 120/80 if you have any other comorbidities, like if you have a diabetes, you have a CKD, or if you have already have a cardiovascular disease. So you have to know your numbers, and you have to achieve it or get it maximum time, maximum time of a week or maximum time of a day. Not that okay, my morning blood pressure was 130, but evening it is getting around 170. So we have to target achieve this target value throughout the day, most of the days in the week, or every week, every month, then every year. Then only we can get benefit of blood pressure control. Otherwise, sometimes it is like 120, we are achieving 120/80, but at the other time, it's evening or afternoon, we are getting it around 140/80. Then there will still be target organ damage. So we should be careful. We should consult our doctor. We should ask them, our caregivers, what is my target value, and accordingly we have to act on that, so that we can get the benefit of controlling blood pressure. Next slide. Next slide, please. Yeah. So diet becomes one of the most important factor whenever we are talking about diabetes or dyslipidemia or hypertension. So as we all know that what is the diet recommended for hypertension prevention, also control, that is DASH diet. Means we have to have low salt, 5 gram per day. Then we have to avoid junk food, and we have to see what is the sodium content of each canned food, each canned food, or whatever we are taking. If we can able to measure, we have to know what is the sodium content in that. And basically use potassium rich salt alternatives if advised. Means potassium rich fruit we should potassium rich food we should take, like with citrus foods, then green vegetables, which is rich in potassium. Basically they help in decreasing blood pressure, and we have to avoid excess of sodium. Next slide, please. Stay active every day. One of the most important factor in controlling blood pressure is exercise. So basically, we have to have an exercise regimen of around 30 to means minimum of 30 minutes per day and minimum of 5 days per week, so that it can be around 150 minutes per week. And thing is that what type of exercise we should do? We should concentrate more on aerobic exercises. Weight training is good, but not excessive weight training. Overhead means overhead weight lifting and exerting yourself when you are doing any gym activity, that is also not recommended. That is known as moderate exercise. How to know what is moderate exercise? When you are doing exercise, basically, practically, and you can talk to somebody else, means you can have a conversation with somebody else without having air hunger, then you know that you are in control and you are having a moderate exercise. So that will be helpful. So exercise, what it does, it relaxes blood vessels, it decreases stress, it increases fat metabolism. In many ways, it will help directly and indirectly to control your blood pressure. Next. Stay calm, stay healthy. New mantra in today's daily means activity is managing stress. So first, I will tell you that whenever if you have any anxiety for anything, don't take it to in your ego. That you should discuss with your friends, you should discuss with your family, even you should discuss with your caregiver or physician or doctor also. Because you ask somebody whether you are having any anxiety, whenever we are suspecting somebody having anxious moments, then they will bluntly tell that no, I don't have any anxiety. Thing is that anxiety is common. Anxiety, each individual on this earth having anxiety, starting from childhood up to old age. Something will give us anxious moments per day. But thing is that we have to control that, because anxiety or stress has direct effect and indirect effect. Direct effect is increase in heart rate, increase in blood pressure. Indirect effect, young people, somebody stressed out, take smoking as a habit, take alcohol as a habit. Sometimes you eat more to decrease stress, that is bulimia. And by doing all these things, you increase your blood pressure, you increase your sugars, you increase your lipids. So we have to stay calm, do these breathing exercises, These are ancient things which has been taught to us from long ago. So we should take advantage of that. We should do breathing exercises. And because what I mean to say, with physical exercise per day, we have to have some mental exercise also, so that you can keep yourself calm. Next slide. Next slide, please. Yeah, good gut health lowers blood pressure. As we all know, every disease in a person, it has a means correlation with your gut flora or good gut or your GI system. What happens that this is one of the one is lungs, one is GI tract, by which we are open to the environment. So whatever we eat, whatever we are drinking, that have a direct or indirect effect on all our mood, our satiety, how we feel, how we behave. So everything depends on your food habit and also your gut microflora. Studies have shown that if you have a good digestive system, then it decreases inflammation. And any disease, the end product is inflammation, which will cause atherosclerosis, which will cause vascular events like stroke, means brain stroke, heart attack, and everything. So good gut will decrease your inflammation, and in that way it can decrease your diseases like vascular. Your vascular health will be good, your blood pressure will be controlled, and you can lead a good life. Next slide, please. So build healthy habits. Alcohol is a strict no. You have to stop smoking if you are doing it. You have to decrease your this junk food in the form of any cold drinks or anything like that. Energy drinks you should avoid. And if you are already a hypertensive and you are on medication, so you make it a habit. You stick to the time of taking the pills. You measure your blood pressure intermittently so that your targets you are achieving or not. Don't stop medicine of your own, or don't take medicine by just going to the counter and having blood pressure medicine. Every medicine you are taking should be prescribed by a registered physician or doctor, and you have to follow that guideline strictly. Next slide, please. So thank you. This is all means what I can say about your lifestyle, if your medications. All the take-home message is eat healthy, manage your stress, have a good amount of sleep, like 8 hours per day. Both exercise is needed, physical and mental exercise, so that you can decrease stress. You can have a physical, you have a good physical activity, so that your body responds to the outer stimuli. Then you have to achieve your target. Any disease you have, any disease like diabetes or blood pressure or lipids, you have to ask your doctors what is my target, and you have to achieve that consistently. And last thing, if you are already a hypertensive, then take your medications properly. Don't skip your medications. Don't experiment with your medications. Don't get over-the-counter drugs. Anytime you just consult your physician or cardiologist, and accordingly you plan your blood pressure journey, so that you can have a good cardiovascular health and brain health. Thank you. Thanks a lot. Yeah, hello.
So thank you so much, Dr. Biswaranjan Jena sir, for your informative session and wonderful insights regarding awareness regarding hypertension. So now we will begin the question and answer session. Participants can share their questions in the chat box. I will read them out for the doctor. So, doctor, one participant is asking how much salt should you take daily, sir?
Yeah, if you are talking about salt, then it should be 5 gram or 6 gram. That is around one teaspoon, or means 1 teaspoon. If you are talking about sodium, then it should be 2 gram. So sodium and salt are different. So chloride, so that is permissible up to 5 gram per day.
Okay, thank you so much, sir. Sir, another participant is asking, can BP becomes normal only with lifestyle changes?
Yeah, it initially when you have stage 1 hypertension, or means initial stage of blood pressure, you can manage it very well with your lifestyle changes. But once you are a higher grade of hypertension, then with lifestyle you have to have medicine so that your blood pressure should be controlled. But lifestyle in any stage, whether it's a preliminary stage of hypertension or pre-hypertension or a advanced stage of hypertension, lifestyle is a must. You have to continue that.
Okay, sir. Thank you so much, sir. Sir, another participant is asking that which Indian foods should we avoid to control BP, sir?
Control blood pressure, we have to avoid extra salt in the form of in Odisha. If we think, then basically extra salt means what? You don't take salt. Means in food, if you are using that around 5 gram, that is okay. Don't take extra like pickles. You have that sukwa thing, which are which are heavy in salt. So you should avoid those type of foods. Then comes you have to avoid cold drinks or any junk foods means or means packet food. We have to avoid that. Anything where and we have to use a good oil also. Mustard oil is a very good oil. Means with the heat we prepare food, mustard oil preserves its identity till means a higher temperature. Olive oil is not for us. Olive oil we should use only as a salad because once you heat olive oil, the good thing of olive oil will go. So whatever, if you can see that Jagannath culture, if you are having, like you have to avoid Videshi aloo or that potato, you have to have whatever available green vegetables with us. Then you have to avoid junk food. Then you have to avoid fatty food and specifically red meat. Then you can have a good diet plan. Whatever Jagannath eats, no, if you follow that, that will be good.
Yes, sir. Yes, sir. Definitely, sir. Thank you, sir. Thank you for your kind information, sir. Sir, another question is tea or coffee harmful for your patients with hypertension?
Sometimes because coffee now we are recommending basically what we do we mix coffee and tea with variable things like sugar and all those things. Otherwise, caffeine it means coffee in a moderate dose can have a good effect on your liver means fatty liver it can help but as usual it's a stimulant so it can cause your blood pressure rise so that's why there is a guideline that before taking or measurement of your blood pressure within 30 minutes you should not have smoked or you should not have tea or coffee because it can increase your blood pressure.
Yes, sir. Thank you, sir. Sir, another participant is asking, sir, can I stop BP medicines once my BP becomes normal?
No, that is a strict no. You can do that. As I told you, initial stages of hypertension means once your blood pressure is controlled with some medication and you are following a robust lifestyle and you measure your blood pressure at least 4 times per day, morning once, afternoon once, evening once, and night once. And if you are getting all the parameters, all the BP measurements in the target range, and then you can try to stop the medication. It can be stopped initial stages, but still you have to consult your doctor and then only you should stop your medication. Without that, you should not do.
Okay, sir. Thank you so much, sir. Sir, last question from our participant. What is the correct way and best time to check BP at home?
See, blood pressure is a variable thing. Means it has a diurnal variation. Means morning time. Means in the afternoon it can have a raised value. There is not a particular good time to measure blood pressure. That's why there is something called ambulatory blood pressure monitoring. Means there will be a machine attached to you. You will do all your daily activity, and everywhere there will be blood pressure measurement. But basically, once you can means early morning there is little rise of blood pressure. So basically, what you do, morning one you have to measure, and evening one if you have to measure, like around 8 to 9 p.m. Then by continuously measuring for 3 4 days, you can very well know your pattern. If possible, you make it 4. If possible, you make it 6 times. So in that way.
Okay, sir. Thank you so much, sir. Sir, thank you so much, Dr. Biswa and Jena, sir, for joining us with in this wonderful evening and delivering a nice talk and your wonderful insights. So it was nice interaction with you, sir, also, sir. So thank you so
Thank
much,
you,
sir.
thank you, thank you, thank you everyone for your patience hearing, and thank you Alembic for giving me this opportunity. Thank you, thanks a lot.
Thank you, sir. Good night, sir. Good night.
Good.